Well, good day to you. This is Greg Downing with Texas Medicare and Health Insurance Advisors here in beautiful Austin, Texas. Now, this is a very short video. I've finally got a few rates that have come in on our health insurance plans under the Affordable Care Act for 2019. It is October the 27th, and I just wanted to show you a quick comparison for a family quote so you can see how you can save some money next year if you qualify. All right, two major things that have happened. Number one, the penalty or the tax for not having an official Affordable Care Act plan is gone. Doesn't matter. You can have any kind of health insurance plan you want. Number two, short-term major medical plans can now be written for 360 days, which is pretty much a full year, and can be renewed up to 3 years after that. So that's what I wanted to show you, is the difference in those costs and how maybe you can save some money next year if you can qualify. All right, real quickly, I'm not going to go through all this. This is basically a family of 4, 2 adults 45, and 2 kids that are 15. I selected Oscar because it is the least expensive plan of any of them that are available out there on the exchange or anywhere. It doesn't matter. And then Blue Cross, actually, their costs didn't go up this year, but they were so high last year, it really doesn't matter. But the main thing that you'll see down here is these are both silver plans, is the cost. I'm not even going to go through and talk about the benefits. Both of these plans have a maximum out of pocket per person of $7,900. Even though may have a low deductible, you got co-insurance that's 50-50. So you still have a lot of expense, and the drug plans are horrible this year. And the cost is bad. But if your family is healthy, or your family and you don't have any pre-existing conditions and you just want to have coverage that's good but not cost a fortune, you want to look at these short-term plans from United Healthcare. The reason is it's a PPO plan. It's a national network. You can go anywhere in the country. If something happens to you to get treatment, you don't have to get referrals and all that stuff. I just compared a plan that was similar to these. This is a $2,500 deductible, gives you $2 million in coverage, and then the maximum out of pocket is $7,500. Now, it doesn't pay for physician visits, but if you use the network discounts, they're going to save you a lot of money. Doesn't cover preventive care, but if you can save $1,000 a month, I think it's a good option to look at. One thing that they do have now, they don't have a prescription plan, but these really don't either till you hit your deductible. But we've got some really good discount cards that apply with this program. And one of the new things they've added is telemedicine, where there's zero money, zero cost to you. You can call up a doctor, tell them what's going on, and they can write you a prescription right over there. Fax it to wherever you want your prescriptions to get picked up, and go pick it up. What we've discovered is about 70% of all ER and urgent care visits could have been prevented with a simple phone call. And they normally happen at 1 o'clock in the morning, and you pay a fortune at the emergency room. We don't want to do that. So these are really good plans that are available. It's an option for you. Again, a reminder, these plans are good for 360 days, then you got to get a new one. They don't cover pre-existing conditions, and not everybody's going to qualify. And short-term plans do not cover all the mandated benefits of the Affordable Care Act, such as maternity, mental health, those type things. So if that's a concern of yours, you may have to go with an official Affordable Care Act plan. Now remember, a lot of times you may just have one person that may have a pre-existing condition. You can put them on an Affordable Care Act plan, and the rest of you can move to a short-term plan. Or if you got to have your preventive care, well, you can sign up for one of these plans for a couple of months, get all your stuff checked out, and then roll over to a short-term plan once everything checks out good, and start saving money at that point. So I just wanted to give you a heads up on that. I don't have Vista 360 rates yet. But I wanted to get these out. They'll be somewhere in between these two plans, and that's what you're going to be looking at. One of the downsides of Oscar this year is they lost the Scott and White network. They only have Seton and the Austin Regional Clinic, and very limited on specialists and other providers. So that's what that. So here's what you can do. If you have any questions at all, you can go right to my Facebook page, Texas Medicare Advisors, or actually Medicare Plans, which should be linked to this. But here's my phone number, and that's my mobile. You can call me, text me. You're only going to be working with me. I'm a local independent agent. 512-656-9378. If you're interested in some short-term plans, I need your date of birth and your zip code you live in, and I can email these right to you, and you can take a look at them. All right, well, that's it today. And when I have more information, I will update everyone. But if you want to save some money in 2019 and you're in good health, the ticket is going to be short-term major medical plans. All right, have a blessed day, and look forward to talking to you soon.